Hi, my name is Shadid, and today I'm going to discuss about major depressive disorder. Major depressive disorder is one of the most common mental health issues characterized by persistent sadness and a loss of interest in normal activities. Unlike temporary mood changes, it causes significant distress and interferes with daily functioning, relationships, and overall well-being. It is formally recognized in both the DSM-5 and ICD-11, which guide clinicians in diagnosing and managing the condition. Typical symptoms include low mood, lack of motivation, difficulty concentrating, fatigue, changes in sleep or appetite, feelings of worthlessness, and at times recurrent thoughts of death or suicide. Together, these symptoms highlight that depression is not a personal weakness, but a complex and serious medical condition requiring compassionate, evidence-based care. Now, major depressive disorder across Australia, like who is affected? In Australia, depression represents a major public health concern affecting a large portion of the population, according to the Australian Institute of Health and Welfare, and 7.5% of Australians experience a mental disorder, which includes major depressive disorder at any given time. When we look at gender differences, depression is more common among females at 8.6% compared with 6.5% of males, a difference of just over 2%. While major depressive disorder can occur at any age, rates are highest among people aged 15 to 34, highlighting its impact on young adults navigating education, work, and relationships. The burden of depression is even higher among Indigenous Australians, with around 19% experiencing depressive disorders, including major depressive disorder. This reflects the ongoing effects of intergenerational trauma and social disadvantage. Additionally, members of the LGBTQ+ community experience significantly higher rates of depression compared to the heterosexual individuals, largely due to stigma, discrimination, and minor distress. These figures show that depression affects all demographics but is shaped by complex social and cultural factors that influence vulnerability and access to care. Why do people experience major depressive disorder? There is no single cause of major depressive disorder. Rather, it results from a complex interaction of genetic, biological, psychological, and social factors. From a genetic perspective, studies show that about 40% of the risk for developing major depressive disorder can attributed to heredity. Individuals with a family history of depression are therefore more vulnerable to experiencing it themselves. Biochemically, depression is linked to imbalances in key neurotransmitters such as serotonin, norepinephrine, and dopamine, as well as dysregulation of the HPA axis, which manages the body's stress response. Psychological factors also play a major role. For example, exposure to chronic stress, childhood adversity, or personal history of mental illness can all increase vulnerability to depression. Environmental and social influences, including trauma, abuse, neglect, unemployment, financial hardship, and social isolation as well, can further trigger or worsen depressive disorders. Overall, depression develops when multiple risk factors interact, underscoring the importance of holistic and trauma-informed approaches to care. Now, what's trauma's role in major depressive disorder? Trauma is one of the biggest risk factors for developing depression. It can trigger or worsen depressive episodes, make treatment less effective, and change how the brain manages stress through the HPA axis, which controls our emotional responses. People who have experienced childhood abuse, neglect, or violence are much more likely to develop major depressive disorder later in life. Trauma doesn't only affect individuals, it also impacts communities. Populations exposed to historical or ongoing trauma, such as First Nations Australians, show higher rates of depressive disorders. This shows that to support recovery, mental health care must be trauma informed because focusing not only on symptoms but also on the person's life, experiences, and environment. Now, there can be treatments for major depressive disorder, but we can divide it into two psychological and pharmacological interventions. Talking about the treatments, psychological therapies are often the first choice for treating depression as they help people understand and manage their thoughts and behaviors. The most common approach is cognitive behavioral therapy or CBT. It teaches people to challenge negative and catastrophic thoughts and replace them with more balanced ones. The strength of CBT is that it is structured, practical, and supported by strong evidence. However, it can be challenging for those with severe symptoms, as it requires active effort and self reflection. Another option is interpersonal therapy or IPT, which focuses on improving relationships and communication. Its advantage is that it addresses social and emotional difficulties, but progress can be slower and dependent on engagement over time. Lastly, mindfulness-based therapies help people stay present and reduce rumination. They are effective in preventing relapse but need ongoing practice to maintain the benefits. Now, talking about the pharmacological intervention or treatments, medication is often used alongside psychological therapy to manage major depressive disorder. The goal is to reduce symptoms and help manage regain emotional stability. The most common medications are selective serotonin reuptake inhibitors or SSRIs, such as fluvoxamine and sertraline. These are considered first-line treatments because they are effective, well-tolerated, and non-sedating as well. However, they can cause sexual dysfunction and digestive side effects. Next are serotonin norepinephrine reuptake inhibitors or SNRIs, including venlafaxine and duloxetine. This can be useful when SSRIs are not effective, but some people experience increased blood pressure or lower tolerance, making them less suitable for certain patients. Older medications like tricyclic antidepressants or TCAs, such as amitriptyline or nortriptyline, are still effective but come with more side effects, including sedation. Overall, medications work best when combined with psychotherapy delivered in trauma-informed and person-centered care approach to support long-term recovery. Now, through SNUG 206, my understanding of depression has deepened significantly. I have learned that depression is not a personal weakness but a complex mental health disorder influenced by biological, psychological, and social factors. This subject has helped me develop a trauma informed perspective, recognizing how past experiences such as stress, loss, or abuse can shape a person's current mental health. I now see the importance of approaching each individual with empathy, respect, and understanding. I have also gained valuable knowledge about evidence-based treatments, including CBT, pharmacotherapy, and the need for person-centered recovery-focused care. Finally, I have improved my skills in risk assessment, particularly in identifying and responding to suicidal ideation and self-harm, which has strengthened my awareness of the importance of early intervention in promoting safety and recovery. Now, in summary, to summarize major depressive disorder, it is a serious and complex mental health condition and it is influenced by a combination of genetic, biological, psychological, and social factors and should never be seen as personal weakness. In Australia, certain groups experience high rates of depression, including women, young adults, Indigenous Australians, and members of the LGBTQ+ community. Key risk factors include genetics, social isolation, trauma, and prolonged stress, all of which can increase vulnerability. Effective treatment requires a combination of psychological therapies and pharmacological interventions tailored to the individual's needs. Delivering care through a trauma-informed and person-centered approach helps improve recovery outcomes. Overall, understanding the complexity of major depressive disorder emphasizes the importance of early intervention, empathy, and evidence-based care to support individuals on their path to recovery. Thank you for being with me. Thank you.